Okay, guys, today we're going to go over a few more key terms for you. Remember that we've pulled most of the chapter apart and we're just looking at some key vocab words. And then I'm going to talk about what some of the diagnostic medical professionals do. So the first word we're going to talk about is stamina. And stamina is simply endurance. Okay. Diagnostic workers have to show a lot of stamina and that they are on their feet all day long. They're moving patients to get them properly positioned so they're getting exactly the right image. They're often moving heavy equipment back and forth. So they have to have good endurance with their jobs. It's not like they're sitting at a desk all day. Phlebotomist. Phlebotomist is a medical assistant who draws blood and receives specimen for tests. Okay. So they use the blood and the specimens for looking for bacteria, looking for parasites, looking for microorganisms, things like that in the testing. They are often analyzing the chemical content of fluids. So they're looking at whether there is drugs or alcohol in the blood sample, looking at a drug sample for a urine test. Okay. They also look at the amount of medication and in blood to see whether a treatment is working. Okay, there's no sense in doing this treatment forever and ever if it's not working or it's not making any progress. Okay, so they use that to check on the progress of different medications or different treatments. Public health laboratory professional. Okay, this is something that is probably easier for you to understand than it would have been last year. Okay, because there are lots and lots of public health things coming to light right now. Public health is a major, major concern, a major issue, and it's something that we talk about or hear about every single day, whether we like it or not, whether we're tired of hearing COVID or not. There are still press releases on every day, and some of these public health professionals are analyzing the threat and analyzing whether these treatments are working or that our policies and procedures that we've been shelter in place and we've been social distancing and all these things, whether they're working or not. Okay, so these health professionals are highly educated specialists with knowledge of one or more scientific disciplines. So they have very, very advanced lab skills. They're looking at new threats and seeing whether our treatments are efficient, whether we need different steps. But they're using their skills and lab testing and results to solve very complex problems in the public health. Okay, public health is something that we always talked about public health when I was in school, but it never became as clear as it is right now. Okay, you guys are living through that right now, where it's public health is very much in our face, in front of us every single day. So you guys will be much better on it than I am. Then we're looking at some medical imaging careers, radiographers. There are, again, this is one of our key vocab words, so we're going to hit it again, but they're those healthcare professionals who create medical images or treat diseases by using radiation. Okay, so they are responsible for positioning patients properly. Okay, when I worked with the orthopedics, some of the radiographers would get very upset because we would send a patient down for maybe a sunrise view of their knee, and they would come back and it was a crappy sunrise view, and the doctor couldn't see what he needed to see. And what did we do? We sent the patient right back for them to try again for a new x-ray. Okay, so the positioning of the patients and the positioning of the machine to get the right angle, the right view, can mean everything when a doctor's trying to diagnose. You have to have those right angles, otherwise x-rays can be quite misleading. Okay, the other thing they have to do is make sure they're aligning those x-ray beams perfectly over the area that they want and shielding the rest of the patient. Okay. Just like when you go for an x ray, you have to wear that heavy um, shield, right, to protect you because we don't need that extra radiation. We want to just get radiation to the area that needs the image. Okay. They have to select the correct settings so their pictures are clear and detailed. If it's a real blurry um, x ray, it's not going to tell the doctor anything. They also work with doctors, telling them and giving them feedback on maybe some additional testing that might be necessary. And of course, they're responsible for the storing and retrieving of these images. Um, I had several imaging studies done in the fall. We've talked about it multiple times. But if I wanted to have a copy of any of those, I would have to contact radiology and they could get discs and stuff made for me. Nuclear medicine technologist. Okay. They are healthcare workers who administer radioactive substances as part of the imaging process. I had a nuclear medicine test done this fall as well. That's the one where I went and they put the radioactive dye in my arm. And then we watched it as it went across the screen and through my digestive tract. That way they could see if there were areas of blockage, there were areas that it wasn't that my digestive system wasn't working. Okay. So these studies focus on physiology. And physiology, remember, is the study of how the body works. Anatomy is of the parts, physiology is how they work together. So these kinds of scans can show different metabolic changes that are occurring within the physiology of the body. They can detect tumors, aneurysms, different things like that. Radiation therapist. They're a healthcare worker who uses CT or other imaging to find a tumor's location and then treat that tumor. Okay, they are the ones doing radiation. Sonographers. They are the healthcare professionals who use medical images through using sound waves. Okay, so we use that for OBGYN appointments to see a baby, a developing baby, to check on the development as they're going through the pregnancy. We use it for breast exams to look at breast tumors sometimes for diagnosing breast cancer. We use it for abdominal and internal organs. I had a abdominal ultrasound done this fall as well, looking at that's how we found out that my gallbladder was so enlarged. Okay, so lots and lots of different uses for that ultrasound. Then we have cardiovascular technologists, and they assist doctors in diagnosing heart and blood vessel disorders. And then lastly, we have the term delegation. Delegation is just assigning tasks to every member of the healthcare team so that one person isn't doing all the work. Every member of the healthcare team has their own thing that they can do, their own strength, their own talents, their own skills, their own knowledge. And that is simply assigning all those tasks to different people. So there's lots of people involved in the healthcare team. That is all the terms we're going to go over today. And then I want you to do the practice activity, and then we will finish up the chapter tomorrow.